Welcome to this edition of our Dementia Care During the Time of COVID webinar series for family caregivers and professionals. Today, we're going to talk about maintaining medication safety at a distance. And we're very lucky to have our presenters, Lisa Morse, who is the lead nurse at the UCSF Memory and Aging Center Clinic. And she handles all of the medication safety questions that come into clinic. And Amy Liu, who is a postdoctoral fellow in clinical pharmacology, and the focus of her research is on medication safety issues. I want to remind people that we ask that you type in your questions. So if you hover at the bottom of your screen, you should see a Q&A icon, and that's where you can type in your questions. You can feel free to type in your questions throughout the webinar. We'll save time at the end for our speakers to answer them. I also want to remind those who are participating in this webinar for continuing education credits that you will get an email tomorrow that will include an evaluation survey link, and you'll need to complete that to get your CEs. And I want to thank the Institute on Aging for partnering with us to provide these CEs for free. So with that, I'll let our presenters take it away. Thank you.
Thanks, Sarah. This is Lisa speaking, and I'll go ahead and get us started off today. Our goal is that by the end of this presentation, you'll be able to describe at least 3 potential medication safety concerns that may arise for family caregivers during shelter in place, identify medication access and organization options to make it easier for caregivers to manage medications from a distance, and discuss medication administration strategies for individuals with cognitive impairment. And to address our objectives, we thought we would first spend a little time talking about how COVID-19 has affected our patients and their caregivers' ability to adhere to medications. Then we'll go on to discuss some strategies to help with medication organization, administration, and access. And we'll end with some practical medication safety tips for storage and disposal. Many of you listening may know that caring for an individual with dementia can be a complicated endeavor, and trying to do this during a pandemic while sheltering in place can be extremely challenging. And with closures of businesses, normal medication access routines via caregivers and other important support systems have been reduced, if not entirely eliminated. And people with cognitive impairment rely on both informal and professional caregivers to help manage their medications. And with closures of adult day programs and furloughed home caregivers, families have had to manage on their own. And as you can imagine, this can be very difficult for those who live apart from the person that they care for, and equally difficult for those who live in the same home and are now responsible for providing around-the-clock care without help. And to complicate matters further, assisted living facilities and hospitals have all closed their doors to visitors, making oversight of care by families even more challenging. Families are also experiencing a loss of income and are contending with an escalation of their loved ones' neuropsychiatric symptoms, such as aggression, hallucinations, and resistance. And all of these challenges threaten the ability of our family caregivers to help those that they care for adhere to medication treatment plans. And this worries us because we know that the elderly and those with dementia are especially vulnerable to the adverse effects of poor adherence. The consequences of poor adherence can sometimes be serious and include suboptimal response to treatment, escalation of behavioral symptoms, increased morbidity, and can lead to adverse drug events. An adverse drug event is defined as any unintended consequence resulting from the use of a drug. Adverse drug events can cause harm and can lead to ER visits and hospital admissions. And it's estimated that anywhere between 6 and 12% of hospital admissions among the elderly are due to adverse drug events. So, when we think about how we might support families and patients in their ability to adhere to medication regimens during COVID-19, it's important to consider the determinants that influence the ability for one to do so. According to the World Health Organization, the determinants of non adherence can be separated into 5 dimensions. These include condition related factors, patient related factors, healthcare system related factors, patient provider therapy related factors, and social and economic factors. And we'll be taking a closer look at each of these areas as we go on. Let's start by taking a closer look at some of the condition related factors. Patients with dementia are often unable to manage their medications on their own due to cognitive or physical impairments, and some helpful strategies to address these factors include things like make a routine. For example, if pills are usually taken with breakfast, consider putting their pill box next to the place where they eat. You can try providing alternative dosage forms, such as liquids if available, or smaller tablets. Some pills can even be crushed and mixed with soft foods like applesauce, but be sure to check with your pharmacist before crushing any medications to make sure it's okay to do so. Provide alternative dosage labels or alternative labels, and introduce reminder strategies such as pill organizers, phone reminder systems, or any medication dispensing devices. And we'll be talking about these in a little more detail in the next couple slides. As you can see here from this medication label photo, medication labels have a lot of information on them and can be very difficult to decipher for a person with dementia living alone. The FDA Safety and Innovation Act of 2012 requires pharmacies to provide accessible prescription drug labeling for the visually impaired and the elderly. And some available options include the audio digital label, and this can be programmed by the pharmacist with medication and dosage information. And as you can see from this picture, a small device is attached to the prescription bottle, and patients can press a button to hear a recording of the medication instructions. Another option is a device called Strip Talk, and this uses a thin microchip which is embedded within the label. And this can be programmed by the pharmacist with all the printed information that's on the label, and patients simply hold the prescription bottle over their Script Talk device to hear medication and dosage instructions. Large print labels are another option, and accessible labels are provided at no additional charge and are available at most large pharmacy chains. Another great way to get medication information across is to provide information in the form of pictures or symbols. And pictograms use symbols to convey medication instructions, precautions, or warnings, and can be very helpful for those whose neurocognitive disorder makes it difficult for them to read or comprehend audible instructions. The US Pharmacopoeia has developed standardized pictograms, and these are available to the public free of charge. The entire pictogram library is available for download on the USP website, which we've linked below, and a list of all of the websites and resources that we're talking about today will be posted on our website. And for those who might respond better to a familiar voice, there are a few options that allow caregivers to record scheduled reminders. Pictured here is the TellRx and the Reminder Rosie, both of which allow caregivers to record personalized voice messages. For those who might need additional prompting, the Cadex watch might be a good option. And this vibrates and alarms when it's time to take a medication. And the name of the medication appears on the face of the watch. It also has a really nice medication or medical ID feature that allows emergency response personnel to scroll through the person's name, medical condition, and emergency contact information by pressing the red alert button.
And hi everyone, this is Amy speaking now, and I'll be discussing a few more medication assistive technology options for individuals with complicated medication regimens, which may help with dexterity challenges or difficult to open medication packages or pill bottles. A website that we found helpful is Tech Enhanced Life, which has a comprehensive medication management guide with detailed reviews for tools, including pill organizers, reminder apps, and complex medication management systems. The cost of these technologies ranges from less than $10 for a simple pill organizer to subscriptions for $40 to $50 per month with the option of emergency call services, to hundreds of dollars for systems that do not require sorting or organizing pills into correct slots. The MedMinder Maya is a smart automated pill dispenser. Subscribing for $40 per month, this 28-day pill dispenser can be filled manually by a caregiver or with a pre-filled tray made by a pharmacist. When it is time to take a medication, the appropriate compartment flashes and makes auditory prompts. The caregiver and family can program and customize preferences for the Maya remotely and receive email or text message notifications and weekly reports about medication adherence. MediSafe is a medication reminder app for smartphones, and the Tech Enhanced Life website has a comprehensive step-by-step guide from installation to setup to adding medications to the application and medication reminders.
And we wanted to share just a little bit more of a advanced medication assistive technology for those who may not be able to visit their loved ones very often and help with medications. This is the Hero Automatic Medication Dispenser, and it allows you to put a 90-day supply of up to 10 different medications in the containers here that you see on the slide. And these can dispense up to 10 times per day based on a medication schedule that you've programmed. And the dispenser will display a visual cue by lighting up, in addition to alarming, and can send text messages to the person taking the medication as well as the person managing the medication. And if a dose is missed or taken later than scheduled, the Hero app will notify the caregiver as well. And the other nice feature about this device is the pill dispenser will let it'll send a notice when their supply is low and remind the caregiver that a refill is needed. You'll need to have Wi-Fi connection, electricity source, and a laptop or a smartphone to make this one work. And it's about $30 a month for a prescription or a subscription. And when you think about the cost of a live-in or a home caregiver, which is in the Bay Area is about $30 an hour, it kind of makes sense to pay $30 a month versus $30 an hour, and especially now you can't hire caregivers to be in the home with your loved one.
So adherence to a medication regimen, no matter how complex, is also influenced by patient factors. A question we often receive at the Memory and Aging Center clinic is, how can I help my loved one take their medicines when they refuse? Helping a family member with dementia safely take their medication can at times be challenging for both the person with dementia and for the caregiver. And resistance to care can be caused by many reasons, such as the feeling of a loss of independence, taking up too much time, or confusion about medication safety or their effects. Sometimes it can also be frustrating and unclear why care recipients are reluctant to take their medications. So some strategies for a patient-centered approach to medication administration for a loved one with dementia can be used. To minimize resistance and confusion, caregivers can establish a daily routine with simple steps and give the most important medications first. Start by creating a calm environment by listening to relaxing music or looking through a photo album so that medication time is a pleasant event. Try to encourage participation, where you pour the glass of water and then you encourage your loved one to pick up the pill from the pill box. You can also take your medications together and say, "I'll take my blood pressure medicine while you take yours." When medication administration becomes challenging or frustrating, remain calm, stop, and try again a few minutes later. Keep in mind that what worked today may not work tomorrow, and that's okay. Reach out to your healthcare team and community who may have some more creative ideas. Depression is another patient-related and caregiver-related factor that may impede medication adherence and safety. Studies show that persons with chronic illnesses who are depressed have significantly lower rates of medication adherence. So caregivers of older adults should be aware of the effects of depression on adherence, and healthcare providers should be able to evaluate individuals who appear sad or withdrawn, or who have unexplained physical complaints or sleeping problems, to identify or rule out clinical depression. During the COVID-19 pandemic, stay-at-home ordinances may have disrupted caregiving routines, stress levels may be higher, and depression can affect an individual's ability to provide or engage in care. Our doctors at the MAC clinic work with the patient, family, and caregivers to identify triggers, environmental factors, and non-pharmacological approaches to care for our patients with dementia before increasing doses of medications for depression, anxiety, or mental health. We've included links on this slide for resources to remind us to practice self-care every day. The MAC Family Caregiver webinar series from last month has several recorded resources for coping with dementia care during the coronavirus pandemic. And also the UCSF Department of Psychiatry has collated some potentially useful wellness and mental health smartphone apps, some of which are available for free to the community and UCSF employees. The third dimension of medication adherence involves healthcare system factors, such as insurance coverage. Your medical insurance coverage may include a prescription drug plan, but this pharmacy benefit information is not typically communicated to the pharmacy by your doctor. Consult your schedule of benefits provided with your health insurance plan for details about your prescription drug benefits, including copay amounts, in-network versus out-of-network pharmacy costs, and whether certain medications are covered in the formulary. When you receive an alert that your medication is ready for pickup at your local pharmacy, you may want to give them a call to ensure your pharmacy benefit information is up to date. This is particularly important at the beginning of the year or when your insurance plan coverage may have changed. When you call the pharmacy technician will be your most helpful resource to update your health insurance information in their system. Have your pharmacy benefits card ready. This may be different from your medical insurance card. So look for the RX BIN, RX PCN, and RX group numbers. Calling and updating your pharmacy benefit information before making the trip to the pharmacy will help minimize the time you spend at the pharmacy counter or the drive-through window. The California Pharmacists Association and the California Department of Public Health provides tips for safe options for getting your medications during the COVID-19 pandemic and while shelter-in-place ordinances are in effect. When possible, request electronic prescriptions to be sent from your doctor's office to your local pharmacy. If a paper prescription is required, these can be placed inside a Ziploc bag and sanitize the bag before handing it off to the pharmacy technicians to protect everyone involved. Many retail pharmacies now have processes for older adults and at-risk customers to pick up medications without waiting in line. Instead of going inside the pharmacy, you can use the pharmacy drive-through or curbside pickup services when available. You can also call ahead and ask for some over-the-counter products like Tylenol and healthcare supplies to be included in your purchase. Your pharmacy benefits may also cover home delivery or mail order of 90-day supplies for maintenance medicines, such as for asthma, diabetes, blood pressure, or arthritis. Be sure to call the customer service number on the back of your insurance card or visit the website of your health insurance plan to find the mail order pharmacy within your plan's network. It's important to note that choosing a non-network pharmacy may mean you'll pay the full cost of the prescription upfront. Then you must submit a claim form to your health insurance plan for reimbursement if your plan includes out-of-network pharmacy coverage. However, it may cost more. Some pharmacies also offer free delivery or charge a small fee, which may not be a covered cost through your insurance. And certain pharmacies and like Walgreens, Safeway, and CVS offer blister packs. So the pharmacy pre-sorts the medication into single-use plastic packages specified by the time of day your healthcare provider includes on your prescriptions. This can help ease the stress of sorting pills when there are complicated dosing regimens, like 3 times a day or 30 minutes before breakfast. Lastly, the COVID-19 resource guide compiled by 1Degree is a quick reference to resources in the San Francisco Bay Area. There's also a separate Los Angeles resource guide. This guide is updated every weekday afternoon with resources as they become available. We were able to find several services for health support and medication pickup for seniors through this guide. PillPack by Amazon Pharmacy is an alternative option for home delivery with the added benefit of medications pre-sorted into tearaway packets. This approach may be helpful because it eliminates the caregiver's need to organize most medications, and it may be easier to open than blister packs. A caregiver account can easily be set up on the PillPack website, and the caregiver can be designated as the main contact. It may take about 2 weeks from the time of account creation to delivery of the first shipment, so it's important to have an adequate supply of medications to cover that time period. A 30-day supply of medications comes pre-sorted into individual pill packs by day and time of administration, such as Monday at 8 a.m., 1 p.m., and 6 p.m. The pills can be split if the healthcare provider specifies on the prescription. Over-the-counter medicines, vitamins, and supplements can also be ordered and packaged, but patients will pay for medication copays and the price of the over-the-counter items. Some limitations of PillPack are that PillPack does not accept or dispense Schedule II controlled substances, so these prescriptions will still need to be filled by local pharmacies. An important limitation of PillPack is also that it's a 30-day fill limit. So your copay may be higher if your insurance gives a discount on 90-day supplies from their associated in-network mail order pharmacy. If Amazon Pharmacy is out of network, you can opt to pay the cash price for the medications. But despite these limitations, PillPack may be a safe and convenient way for home delivery of medications.
Okay, so let's shift a little bit and talk about how clinicians and caregivers can work together to make medication management during COVID-19 more successful. Evidence indicates that there's a strong correlation between a clinician's communication skills and a patient's capacity to follow through with medication recommendations. Patients who report a high level of shared decision-making within the encounter are more likely to adhere to treatment plans. And shared decision-making is a process in which clinicians and patients work together to make decisions that balance risks and benefits and takes into consideration patients' preferences and values. And it's important that clinicians adequately explain how to take medications and discuss with patients any reluctance that they might have. This can provide a better understanding of the patient's beliefs and knowledge about their health and treatments, and simplify their regimen wherever possible. This is crucial. Consider eliminating medications or supplements that aren't absolutely necessary. We know that adherence worsens as a function of the number of times per day a patient has to take a medication. For those who might be interested in delving further into this topic, we encourage you to check out a web blog called GeriPal. It's a great resource and it explores geriatric and palliative care topics. Just recently, they had a web blog discussing non-adherence, inappropriate prescribing, and adverse reactions. And we've provided a link to that particular episode below. It's also important for caregivers to take an active role in learning about the medications the person you care for is taking. We recommend keeping an up-to-date list, and I've provided here a link to a medication list template. Additionally, apps like drugs.com, MediSafe, and Apple Health can help make staying organized and learning about medications easy. Another great resource is your local pharmacist. I also recommend enrolling in an online account through your healthcare organization if they offer it. Many institutions use MyChart, and these platforms often allow family members to share access with one another. And this is a great way to have quick, up-to-date information, medical information if you need it. And you can also easily message providers with concerns and request medication refills. I also encourage you to feel comfortable reaching out to your clinic care team and ask questions. I provided a list of questions that might be helpful in guiding your conversation about medications with your care team and clinician. Next, we wanted to provide some resources for those who are experiencing a loss of income or who are finding it difficult to pay for medications. As as you know, coverage gaps and formulary restrictions can be financially burdensome, even for those who have great insurance. Patient assistance programs sponsored by pharmaceutical manufacturers are available to those with no health insurance or who are underinsured. And these programs can help lower the cost of drugs. Each pharmaceutical company has its own enrollment process and acceptance criteria. So if you're interested in these programs, you'll have to visit the manufacturer's website directly. I've also posted a link to an article with more information on some of the largest patient assistance programs available. And I just wanted to spend a little time talking about Medicare Part D. So Medicare has the option of allowing people to pay a monthly premium for an outpatient prescription drug coverage, and this is called Medicare Part D. But there's some frustrating caveats to this plan that I thought were important to mention. Some of you listening may be familiar with what's commonly referred to as the Medicare donut hole, and this often hits patients unexpectedly. The Medicare donut hole is a gap in prescription drug coverage, and it begins when the amount of money spent on your drugs by you and your plan together reaches approximately $3,000. And at this point, you become fully responsible for the cost of your medications until you've spent a total amount of $4,500 out of pocket. And I often get calls from patients asking me, why their prescription medications are so expensive all of a sudden. This can be a really serious issue for those who are not prepared to fork out that amount of money. State programs such as the California Health Insurance Counseling and Advocacy Group can help. They provide free counseling services to help people understand their health insurance benefits and can suggest supplemental plans that can help coverage during gaps. And if you're listening from a state other than California, you can find the health insurance advocacy group in your state by going to the State Health Insurance Assistance website, which we've linked at the bottom of this slide. Needy Meds is another great program and offers a discount card to lower the cost of prescription medications. And it's great because it can be used during the Medicare Part D coverage gap. Another useful program is the GoodRx, and their website allows you to compare prices of medications at competing pharmacies and download coupons. And they also have a great app that's easy to use. RX Outreach is another great option, and it's helpful for the uninsured or for those who have low income. And they're a fully licensed nonprofit mail order pharmacy, and they offer qualifying individuals prescription medications at low cost. And if you're interested in trying some of the assistive technology that we've talked about today, I encourage you to visit the Association of Assistive Technology Act program website. They're a nonprofit organization, and they sponsor state programs. Every state has a program, and they have a variety of medication dispensing devices available for loan, so that you can try them out before you purchase them. Devices can be borrowed for up to 30 days and can usually be shipped directly to your home. They also provide an exchange program for lightly used equipment and offer state financing for people who need to purchase assistive technology.
So lastly, maintaining medication safety does not always involve administering and taking medicines. Safety also includes how to store medications between doses and how to dispose of unused pills or used insulin needles. Properly storing medications and devices such as glucose meters and diagnostic testing strips between doses can help ensure that they work as intended. Heat, air, light, and moisture may damage medicine and devices, so take care to find a cool, dry place out of direct sunlight and away from heating and air conditioning vents to store your pill bottles or organizers. For most medicines, a consistent room temperature of about 70 degrees is appropriate, but please check the specific labels of your medications or ask your pharmacist for storage instructions for your medicines. Moisture and humidity may also make medications less effective or even toxic. So for example, if aspirin tablets are exposed to water or moist air, the active ingredient breaks down and produces a vinegar-like odor. You should dispose of the entire bottle of aspirin if a strong odor is present. The medicine cabinet in a bathroom is actually an inappropriate place to store your medications because the heat and moisture from your shower, bath, and sink may damage your medicine or make them expire more quickly. Better storage solutions are in a dresser drawer or in a kitchen cabinet away from the stove, sink, kettle, or any hot appliances. If you do move your medications to another place, it's helpful to write a little note in the original storage area to remind you of the new location. Also, always store your medications out of reach and out of sight of children and pets, and use a locked box if needed. Keep in mind that some medications also require refrigeration to stay effective. Insulin must be stored in the refrigerator before opening, then can be kept at room temperature after opening for 14 to 28 days before discarding. Certain eye and ear drops and some liquid forms of antibiotics must be refrigerated for the entire duration of use. Please refer to the labeling on your own medications, on refrigeration requirements, and ask your pharmacist for clarification. So when doses of your medications change or your healthcare team has worked with you to stop taking a certain medicine, you may find that you have unused tablets, syrups, or topical products left over. Or if you are cleaning around the house and find old or forgotten medication bottles, what is the safest way to dispose of them? First, gather or move expired, unused, or damaged medicines to a separate place, away from your current medications. Second, find the nearest safe drop-off location on takebackdrugs.org, which has a map created by the California Drug Take Back Program. Or you can Google Maps and type in drug disposal near me. Regulations in other states may differ, and I encourage you to find the resources specific to your location. Then you can follow 3 easy steps to safely dispose of your expired, unused, and damaged prescription and over-the-counter medications, medicated ointments and lotions, and pet medications. Step 1 is to obscure personal information from the containers with a black marker or remove and shred the prescription label. So this would include your name, the RX number, and the prescription information. Step 2 is to pour the pills out of the containers into a clear zip-top bag and place any medicated ointments and lotions in their original container into the bag. Then zip up the bag and you can recycle the pill containers that are now empty. Step 3 is to bring your filled zip-top bag of expired, unused, or damaged medicines to the nearest safe drop-off bin. If you have to wait until shelter-in-place directives are relaxed before safely disposing of your medications, clearly label the zip-top bag as unwanted medications and store it away from your current medications. Another safe option for disposing of expired, unused, or damaged medicines is to participate in National Prescription Drug Take-Back Days, typically held in April and October. The April 2020 National Take-Back Day was postponed due to the COVID-19 pandemic, but you can check the FDA and DEA websites for updates. If the previous drop-off options are not readily available, there are certain unused medicines that you can safely dispose of in your household trash by mixing the pills, tablets, or capsules with an unappealing substance such as kitty litter or coffee grounds in a zip-top bag before throwing out. Then obscure and remove and shred the prescription label before recycling the original containers. This infographic is a decision tree to help with safe drug disposal options. The best way to safely dispose of your used or unused or old medications is to use available drug take-back bins or events. But if there are no drop-off options nearby, your next best option is to check the FDA flush list, which is linked at the bottom of this slide, and the resources will be available on our website, to see if any of your medicines should be flushed down the toilet. If none of your medications are on this FDA flush list, then you can follow the instructions on the previous slide to dispose of your expired, unused, or damaged medications in your trash at home. And lastly, used sharps such as needles, syringes, lancets, and auto-injectors must be disposed of safely. Rigid plastic containers with safety tops made for biohazardous sharps disposal may be available for free or purchased from medical suppliers, hospitals, or pharmacies. If you cannot get a sharps container, the FDA recommends using an empty household container, like an old laundry detergent bottle that has been washed out. If it's made of heavy-duty plastic, does not leak, stays upright, and has a tight-fitting lid that cannot be punctured. When your container reaches the full line or is 75% full, find your local disposal options at safeneedledisposal.org. Disposal rules and regulations vary across states and localities, and the website has an interactive map to direct you to guidance for safely disposing of sharps in your area. And to conclude, some key takeaways from our webinar today include the 5 dimensions of medication adherence are an interplay of condition, patient, healthcare system, patient provider, and therapy related, and social and economic factors. And also maintaining medication safety at a distance involves many strategies, techniques, technologies, and very importantly, caregivers. So we'd like to thank the Institute on Aging and the Memory and Aging Center Behavior Task Force for putting on this webinar series. And now we'll hand it back over to Sarah.
Great, yeah. So I just want to encourage everyone to type in their questions. And it also occurred to me that, you know, I hear from a lot of the caregivers I work with around the, you know, patients either taking more medications than they're supposed to, for example, inhalers or PRN pain medications, or also on the flip side, refusing medication. So if people in the audience have tips or strategies that have worked for them, please share them. I had a question, well, around the topic of people taking PRN medications, particularly pain medications, more than they're prescribed, or another medication that might be more high risk, like a sleep medication. What would your thoughts be about that?
I can answer that question. So if you're concerned that somebody has taken too much medication, especially if it's a sleep medication or a pain medication, this could be a medical emergency. And this is a difficult situation where, you know, if this person lives alone, obviously it would be important that a caregiver is checking in on them and has a routine for, you know, to know if the patient's not answering their phone, we need to have somebody go and check on them. And if you do live with the patient and if the person and they seem more lethargic or different at all, it's okay to call the paramedics and get them evaluated. You can also call the clinic, but if your gut is telling you something is wrong, go ahead and call 911. No one is going to be upset if you're wrong and it's not an emergency. And if the person lives alone, you can always call the police department to do a wellness check on the individual, and have them go to the home and knock on the door.
Yeah, thank you. One resource that I learned about from a situation where the patient, basically finished the rest of the bottle of their antidepressant medication on accident was the poison control hotline, which is a national hotline that's staffed by pharmacists, and they can give you advice on like what to look out for and whether you need to take the person to the hospital or not. So that I think is another important resource. So Robert Lane is saying that sometimes IRX arrive by mail in a container with ice packs, but also the same, this sounds like an eye prescription, arrives by mail unrefrigerated. So why would this not be consistent? This is for latanoprost. It seems like it might be useful to call the pharmacy too, if it's inconsistent. It might be an error on their part.
I agree, and sometimes medications may be shipped on ice packs, but medications can sometimes also be stored for a certain number of days unopened, either inside the refrigerator or at room temperature. It depends on the medications themselves, and the stability of the active ingredient may have been tested for a certain time period outside of the refrigerator or in the refrigerator. So if you are concerned, please call your pharmacy and check with them to double check that the storage conditions of your particular medications.
Thanks for that question. On one of your slides, you talked about, if a patient is refusing medications, prioritize the most important medications. So how would somebody go about figuring out which medications are the most important?
So that's a great question. And I think to start off with asking your doctor or healthcare professionals which medications they believe should absolutely be taken on a consistent basis. And then kind of going through a checklist of those medications before reaching the vitamins and supplements that may or may not be as important for consistent use. However, it is encouraged that medication adherence is very important, and taking some breaks in between taking the medications might also help with medication refusal.
So just trying again later?
Yes.
With some of the less important medications.
Mm-hmm.
And in terms of this time of COVID, where people are, legitimately afraid of getting sick, people might be tempted to self-medicate with medications that are, not recommended by the medical community. Is there anything out there that is shown to help prevent complications from COVID, or anything that is recommended?
So thank you for asking this question. We actually have a slide about this. So right now, there have been some reports in the media about alternative remedies, vitamins, or supplements that may be effective at preventing or reducing the severity of COVID-19. And clinical trials are currently being conducted for adjunctive treatments, but to date, there are no clear scientific evidence that these alternative remedies can prevent or cure illness caused by COVID-19. So some of the examples of alternative remedies are things like elderberry or echinacea, ascorbic acid, zinc, or melatonin. And so again, none of these have been shown to prevent or reduce the severity of COVID-19. And I think to add to that, with NSAIDs, so there was another concern that was expressed by some healthcare providers and many in the media that ibuprofen may worsen COVID-19 symptoms, but the FDA released a drug safety statement dispelling these concerns. So there is no scientific evidence connecting the use of NSAIDs like ibuprofen to worsening COVID-19 symptoms. So it's always wise to check with your doctor before taking any medication or stopping any medication, and that includes herbs, vitamins, and supplements.
Thank you. And I'm curious also, as you mentioned, a lot of people are dealing with behavioral exacerbations and might not have access to the kinds of activities that might help them cope with these situations and might be resorting to medication. How long typically does it take for you to see the effect of a medication to help, someone sleep or kind of decrease agitation?
Yeah, so this is a question that I get a lot in the clinic during this time. And, families are just trying anything they can to help the situation at home. And we always try to walk through that with them, any environmental triggers that could be just altered a little bit to help the situation and redirect the person that's being agitated, because there can be a lot of things that we don't think about that might actually be the cause. And by fixing those, we could actually alleviate those outbursts quicker. Because your question, as you mentioned, sometimes these medications can take up to 6 to 12 weeks before you really see the effects of antidepressants or antipsychotics, and depending on the medication, of course. But we do try to help with the in-home environment or any triggers first, identify any triggers.
Yeah, so I guess along those same lines, if you don't see any effect in a few days or a week, you might want to hang in there because it still could have an impact.
That's right. And so that's actually one of the reasons why people stop taking medications, is because they're just not seeing a benefit. But it's true. You should wait until the full amount of time, the 6 to 12 weeks, before you give up.
Thank you. And we have a question or a comment from Kristen that sometimes, doctors prescribe a medication for more than once a day, and the client isn't able to comply. So, is it? It sounds like she's able to speak to doctors to ask them to, change the doses. I wonder if I know that we have that's come up for people taking Namenda, for example.
Yes.
I wonder, if you have any comments on that.
Well, yes. So there is an option to take an Namenda extended release, which you only have to take one time in the morning. It's really expensive, and you'll need help from a pharmacist or the clinic care team to advocate for you with the insurance company and get a prior auth so that they cover the once a day dosing instead. So sometimes things like this take having a conversation with your care team and the pharmacist to see what other alternative dosage forms are available.
Yeah, and I've heard, I forget, I may is a pharmacist I worked with in the past who he felt that it was actually, in particular for Namenda, that it was safe to take the 2 doses one time a day instead of twice. So maybe in some cases, but it definitely isn't something that you necessarily want to do, because other medications like for Parkinson's, Sinemet definitely needs to be taken spaced out. So I guess along the same lines with the medication or the pain medication questions, if the patient is taking too many, to talk to the doctor about scheduled dosing and adjusting scheduled doses to that comes up with behaviors too that PRNs can be difficult to track and know like how much they're getting and how well the medication is working. So sometimes, especially when you have to observe the effect in the person who's taking the medication, it can be easier to work with scheduled doses and
rather than PRN. Yes, definitely. and rather than just relying on judgment if you should take, the medications. Yeah.
I just wanted to comment. I loved your, I forget who made the comment, but I have heard from other caregivers that they are successful in helping, someone agree to take medications if they take theirs. So I don't know how that trick works, but I wonder, I just want to again invite people if they have any other ideas. I know sometimes people, especially with the medications that I think can be for behaviors that might make people feel different, feel a little sedated, that they might be less likely to take it. And so ways to, and then there's that whole, idea of therapeutic lying and people feeling guilty or uncomfortable, kind of tricking someone into taking their medication. So
we use the term therapeutic lying in our clinic, and whenever I say that to a caregiver, it just makes them feel so relieved that's okay. And it really is, in this population, okay to use any tactics that work, if it's in the best patient, if it's it's for the best of the patient, that they take their medication, so that they can have a better quality of life and feel more calm and enjoy their day. So do what works, whatever you have to do sometimes.
I also really appreciated the content about insurance coverage, because I know, you learn about all these, for example, the devices that you mentioned, and it seems like a really, they can be in some instances a really cost-effective way to improve medication adherence. At the same time, it sounds like most of those are things that you have to pay for out of pocket. Is that your sense, that those aren't covered by insurance?
Yeah, Amy and we spent a lot of time looking into this. We were hoping we were going to find some magic solution for paying for these devices. And some private insurances may cover these, but the majority of our patients are on Medicare, and they don't cover that. So I really encourage looking into those state programs, the assistive technology state programs, and they actually have a lot available to borrow and try out that way. And I don't know, Amy, do you have anything else to add to that?
I have nothing to add, but I think those programs are great. And the fact that you can test out a product to see if you like it and if it works with your style of caregiving, and whether it works into the caregiving routine is fantastic before you do try to find a discount card or funds to pay for the device out of pocket.
I also, when you talked about resources for people who have difficulty paying for medications, I think, with the economic impact of COVID, this may become even more of an issue. And, I've heard about people, trying to take less dose or space out their medications, changing how much they're taking. Curious what the risks of that might be.
Yeah, so if you take lower than is recommended, you may not actually be getting the intended outcome of the medication. So that could cause harm. So some of the programs we talked about in the last slides can help pay for medications, and always, reach out to us in the clinic and the pharmacies. We know a lot about these programs and ways to help. So, give us a call before you start changing around the amount or spacing in between your medications. We'll work with you, and maybe we can think of a better plan.
I agree. And a lot of the patient assistance programs through the drug manufacturers can either cover a lot of the cost of the medications for some of the more expensive, say, injectable medications, or they have income-based plans to help with the copays as well. So there are a lot of tips and tricks that some of your healthcare providers may know about to cover the cost of medications. And again, I'd like to caution not to change the doses or add or stop any medications without first consulting your healthcare team.
And I also wanted to ask about Getting back to inhalers again, I know that, we're not pulmonology nurses or pharmacists, but I do think this can be, using inhalers or breathing treatments can be tricky for people, especially if it's new, when they have a diagnosis of dementia. And I heard about a certain kind of inhaler, perhaps, I think it's called Spiriva, that's probably the brand name. And I don't know how widely available that is, but do either of you know about types of inhalers that might be easier for older adults with, less coordination to use?
So this, are you talking about the Spiriva Respimat? It's
I
kind of
think
a
so.
device. Yeah, it's a
Yeah.
device that is more of a mist. And
Mm,
so it doesn't require a lot of coordinated breathing to take. And
mm,
so this may be appropriate. There are also spacers
Hmm.
that can help with the coordination of breathing. So basically, it's a plastic tube that you attach on one end the aerosolized like albuterol, and then on the other end is a mouthpiece. So first you can depress the albuterol, it enters the chamber, and then the patient just has to breathe slowly. And there's a little whistle. So if you're breathing too quickly, the whistle will sound. And so that can help with a lot of the coordinating breathing challenges that might occur with a handheld albuterol inhaler or HFA. But there are many different types of inhalers, and the pharmacist can teach how to use the inhaler in the pharmacy, or there are a lot of videos online as well from the California Pharmacist Association and other national organizations to use these more complicated inhalers.
So likewise for people who are taking insulin who might start to have more trouble with, using a regular insulin syringe, they can work with their pharmacist to try to access different kinds of devices that might be easier for them to use.
Yeah, so this is a complicated issue. And so you may be able to get pens covered, which would
Mm,
be a little bit easier to handle, but then you'd need somebody to dial the pens each dose. Um,
mm,
but so what's recommended is to have somebody pre-fill syringes and store them in the refrigerator. But the person would need to be able to know to go to the refrigerator and grab one dose of insulin and when to take it. So some reminder apps might help there, or the watch system that we mentioned. Um, Amy, do you have anything to add to how to help with that?
Yeah, I think the biggest thing is to see what is covered by insurance, and sometimes there are alternatives and different devices that can be prescribed so that it will be easier for patients with dexterity issues or sight issues.
thank you. Yeah, I recognize these are complicated situations. And we have another question about continuing to use medication after it is expired, at least for a short time.
Hmm.
They're not specifying the medication. I know you mentioned aspirin, you should definitely throw out when it smells like vinegar.
Yes. So yeah, it does really depend on the medications themselves, but the expiration dates on the bottles are for tested conditions where the label itself will specify. So I would really encourage you to read the labels of your medication bottles or ask your pharmacists, considering the type of storage situation that you have and how long the expiration date has passed from.
Mm-hmm.
So most of the time we would abide by the expiration date. So I would check with the pharmacist about your specific medication.
Okay. So I don't see any other questions, and we're getting to the end of our time. So I want to thank our presenters and also remind people that to join us next week for talking about coping with behavior challenges during this time with Jennifer Merrilees and Mary DeMay. And also just to remind you all to look for your survey, your evaluation survey that you need to fill out to get CEs. And thanks again, everyone. Thank you for joining us.